all those doctors, you see, who have done a great contribution in this campaign to save the girl child.
हम लोग लिटिल डॉक्टर्स कैंपेन लॉन्च कर रहे हैं, जिसमें ये होगा हर बच्चे को ऐसे ट्रेन करेंगे जो एक्सपर्टाइज टीम है।
3, 2, 1! The Fit India movement is being launched, and we should be all fit and stay healthy.
And we wish it success. We need your cooperation and help.
We are truly humbled as we request Dr. SUNITA DUBE for her welcome address. Thank you.
Thank you, Simran. You have said so much, and we are totally humbled with all compliment we received for the Medscape India, and it's totally a collective effort of entire medical community. So it's a namaskar, very good afternoon to all of you. Behalf of Medscape India family, and warm greeting to all the respected doctors, healthcare warrior, policy makers, student, and fellow citizen. Today, Medscape India is completing 20 year, and Fit India movement completing 11 year, and 8th Fit India movement, Fit India Conclave Doctors Day program today. So today we are taking a very special movement where we would like to give tribute to people who have lost life during this Ahmedabad plane crash, where a lot of doctors sitting in working, eating the food in the mess, and also in the flight. So this is a really today we all the doctors and सारी चिकित्सा संस्थाएं मिलकर गहरा शोक व्यक्त करती हैं कि एक होनहार छात्र को खोना एक परिवार की उम्मीद को खो देना है। हम सब उन सब दिवंगत आत्माओं को श्रद्धांजलि अर्पित करते हैं, चाहे वे डॉक्टर हैं, स्टूडेंट हैं हो या आम आदमी। मेडस्केप इंडिया फैमिली उस परिवार के साथ खड़ी है, संवेदना और इंसानियत के साथ। Despite limited time for fundraising, our resolve stands firm with our doctor. Will be soon visiting to Vijay Medical College, and also will be supporting whatever way we can do. And I would like to say right now with us, Dr. Meenakshi, also Parekh is there. She is a dean to Vijay Medical College, and she's also there hearing our condolence. So I would like to go and tell about the 20 years of our service from pain to policy. For 2 decades, Medscape India has worked as a bridge between policy and pain, between doctor and people, between healthcare and hope. From Save the Girl Child to Training Lifesaver, our journey is powered by purpose and compassion. India's first, I would say, in 2014, publicly we got the CPR training. And from that time, almost 15 lakh CPR trained people are around. More than 1 lakh under 15 with the support of our volunteer associate and doctor. पर आपको पता नहीं होगा CPR एक्चुअली मैंने पहली बार कब किया था। 2000 में जब मैं स्टूडेंट थी, आई वॉज इन बॉम्बे हॉस्पिटल, वहाँ पे अंडर द डॉक्टर PL तिवारी, आई वॉज इन कार्डियक डिपार्टमेंट, आई यूज्ड टू डू defibrillation and also the CPR. I had visited to one of the very remote area of our country, and there I saw one lady had jumped from 4th floor, and she was declared almost dead. So that was the first time I went and did the CPR. Her relative gave the mouth-to-mouth oxygen to her, and near local, I could, all emergency life-saving drug was provided. And by the time we could shift her, she was almost alive. And that was the time, I think, as a student, I convicted in my mind that today I'm learning CPR can save life. So what I feel ki thanks to all the train and trainer model in school and college, we are not waiting for emergency. We are preparing hero in every home. So CPR today, I mean, once upon a time, I remember when I was doing CPR, I had to explain what is a CPR, cardio, pulmonary resuscitation. But today when I ask people or hear people, oh, everybody knows it is a CPR. You can save life once you learn. It's a small 2-minute procedure. You can save life in the flight and in school and college. And we have a great story with our all volunteer. So I really say where I'm looking forward India to become first skilled country where everyone knowing how to save a life. And of course, right now in Maharashtra, there also I'm looking, a lot of people are already doing in collaboration with the state and central government. Fit India to Fit Bharat, wellness at the scale. Since 2014, our Fit India movement has launched state-wise wellness drive. Our goal, at least 5 fit city per state with the screening, mental fitness program, and preventive care in the partnership with the local and central government and institution, fighting addiction and mental illness. Addiction is a silent epidemic of our country, especially in the Maharashtra, Punjab, and Goa. We are actively running awareness drive, the addiction support system, working with the NGOs and the medical institute to save life and restore the dignity of our youth. We have a blood donation camp, Lifeline of Hope. In states like Delhi, Maharashtra, Uttar Pradesh, our regular blood donation camps are saving thousands. We salute our youth, the real hero who give without expecting anything in return. The Save the Girl Child, from awareness to empowerment. Our 19-year-old campaign is now evolving into action at the upcoming 15th Medscape National Award. Our theme is skill and finance for the girl child because true empowerment means making girl emotionally, educationally, economically future ready. Today I would like to share something very special. Being a radiologist and we on and off see so many cancer patients in the sonography, in CT, X-ray. We keep on diagnosing, and our patient we diagnose, and beyond that treatment, we are just back of the treatment only. So today we'll be launching a launch of Tara Cancer Support for the people who are suffering. Cancer is not just a disease; it's a battle of body, mind, and soul. All today, every household getting penetrated by the dread disease of cancer. Today, we are going to launch the poster of Tara, our AI-powered cancer helpline, a tribute to my late father, Ghanshyam Dubey ji, a true legend. Tara is a more than a tech, it's a empathy, navigation, emotional strength, support for every patient and the family. We'll soon formally launch Tara with support from the state and central ministry, health ministry, and various cancer institute. Our dream, the health and education as a fundamental right. If we truly want Viksit Bharat, then let us declare स्वास्थ्य और शिक्षा भारत में मूल अधिकार हो. No child should be died due to lack of money. No girl should drop out because school is unaffordable. Let's dream of India where every citizen gets free healthcare and education regardless of income or PIN code. Our focused area of the Medscape India is rural health, reaching the forgotten through mobile clinic, ambulances. Medscape India reaching the most remote tribal rural area, delivering the care where hospitals don't exist. Public-private partnership, CSR module are helping us to heal and to fulfill our dream. So this is स्वास्थ्य रक्षा मतलब देश की रक्षा. अगर आपके हेल्थ केयर फ्रेटर्निटी सेफ है तो मतलब देश भी सेफ है. Medscape India, in collaboration with over 57 medical body, national medical body, and more than 8,000 healthcare institutions, stands united in the long-standing fight for the prevention of assault on doctors and healthcare professionals. Through the sustained dialogue with the petition committee, health ministry, judiciary, parliamentary leaders, including over 15 formal representation during zero hour and question hour, the medical fraternity has collectively echoed this concern through the highest democratic channel. From NMC to Niti Aayog Association to policymaker, every healthcare voice has worked to sensitize the system. What was once a fleeting debate, rising like a bubble and fading, has today found continuity, clarity, courage, and through the Medscape India's leadership. Now the responsibility lies with the government. We seek not privilege, but protection, not delay, but the dignity. Let the doctor, the nurse, the ward boy, the ambulance driver, anybody who's working in healthcare be safe. When fear overshadows service, trust begins to erode. And today, the fear is silently discouraging parents from guiding their child to take a medicine. This invisible crisis is not just our doctor medical fraternity. It is the nation's biggest loss in the future. Doctor in Sports, which is one of the biggest campaign we are running from 2012, where all our doctor play the cricket and still in the sports just to keep themselves healthy, fit, because the stress level in healthcare is increased. So I really congratulate each and every doctor, whether they are associated with the Medscape India or not associated, giving sports priority to boost their immunity and health and fitness, and also fighting the stress. And I believe the spirit what they have to be fit and healthy, it is instilled within them as a Fit India. I would like to say something very small to our citizen also. Health is a national duty. It's not only the doctor and government. Be responsible citizen, donate blood, avoid addiction, learn CPR, join organ donation. You don't need a white coat to be part of India's healthcare army. Your awareness can save life, and your involvement, your concern within your family and monitoring your day-to-day life and lifestyle definitely will improve the current status of the healthcare of India. From the doctor's heart, we are here to heal you, but healing is a two-way street. Even you have to take care of yourself. Even you have to participate every day in your life to improve. Respect your doctor. They are not God, but skilled human being doing their best. Let's the let's build an empathetic, united, and healthier India together. I thank all the speaker, all the minister, all our associate, all our associations, all our doctor, all our Padma Shris, all people who are working with the Medscape India and Iron Hospital, all of them, their active support and unwavering strength and support there for all the work we do. Unfortunately, we were not able to do in Vigyan Bhavan because of the circumstances, but it went on a hybrid. In a very short time, everybody have come forward, and that's amazing. A call to every heart. Let us pledge to heal every heart, to protect every doctor, to empower every girl, to reach every village, to build an India where no life is lost due to silence, stigma, or injustice. Medscape India is not just organization for their selfless or unconditional support. It is a movement. It is a mission. It is a mirror of Bharat soul. कोई और नहीं बदलेगा हालात को यहाँ, कोई और नहीं बदलेगा हालात को यहाँ, को खुद से ही शुरुआत करनी होगी. जय हिंद, नमस्कार, thank you so much.
Always been very encouraging and inspiring, and the kind of beautiful soul that you've been by always believing in giving is truly worth sharing with the entire world. Thank you so much, Dr. Sunita Dubey. Friends, ladies and gentlemen, we all know it's still very fresh in our hearts. May we please take a moment for the tribute to all those who lost their lives in the Air India plane crash, including the brave doctors. They were the mentors, the caregivers, the healers, the beacons of hope for countless families. May we please maintain silence and have the video, the screen, for those who lost their lives as a tribute from Fit India Conclave.
Thank you very much. On the, we can say, prelude or curtain raiser or pre-evening of Doctors' Day, I wish all of you, all the doctors and all my community a very happy Doctors' Day. And you are with Dr. B.N. Gangadhar, my friend Dr. Harsh Mahajan. Simran, you have said very nice thing, very nice prayer for our colleagues, for our budding doctors for tomorrow who have left us untimely. And this has added to our mission. So far, we were addressing the protection of the doctors. My friend Harsh is also seen My salutations to Dr. Gangadhar and Dr. Harsh Mahajan and all those who are joined. And this is something which is serious for everybody who is in administration and control of India, and for everyone who is directly associated with welfare of doctors and the whole community of paramedics, nurses, and in COVID days, we address to even ambulance drivers, cleaners of the hospitals. So we all are a community, and this red heart, what we are showing here in Doctors' Day, is heart of India. It's not our heart. It is a community whose heart is with the patient, for the patient. We sleep for the patients and we wake up for the patients. And we are doctor round the clock. In no profession of administration, a person is involved round the clock. He is an officer 9 to 5 or 10 to 5. And whatever duty he does, it is according to time. But a doctor, since he pledges to become a doctor, he is doctor throughout his life till he takes a last breath. This is the difference in our profession and other professions. SUNITA DUBE, I congratulate you for organizing this event, this meeting, despite you have exigencies around you, your family, the death of your father, untimely death of your father, and you worked hard to serve him and kept doing this work, and your mother, who is also, I'm told, not well. So with this, if you are shown here and presenting and joining all of us for a noble cause, it's a great work. And we have seen in the past that doctors are treated like all other human beings by our administration. Probably we require a separate consideration which you are fighting for a long time. And many politicians you have involved and they have worked hard to serve for your cause. And the cause is very simple: to protect the dignity and health of doctors and to protect the safety of doctors. So this is very important, and unless this is done, we are most a commodity which is most dangerous and most fragile and available round the clock to the people to deal with their anger, deal with their thoughts, emotions, and panic and the erratic reflexes which they come across. So this is a human nature, no fault of theirs, but it would be worthwhile to talk about the body which should be legally empowered to protect doctors' rights. Not rights, but safety. And you are pleading for a tribunal, and we are all with you. And thousands of organizations are with you. And my dear friends are there to speak their thoughts. I salute everyone for being here on this platform and wish you a very happy Doctor's Day and also wish you good luck. Behind the mask, caring for caregivers. This theme is there for tomorrow and we should stick to it. And caregivers do need care.
Dr. Mohsin Wali, sir, thank you so much. So rightly said, yes, you sleep by healing them and you wake up just thinking of healing them. You've had sleepless nights and 24/7, all you do is dedicate your life to the service of humankind. And we couldn't have really expressed this feeling on a better moment like this where we are celebrating International Doctors' Day. Humble thanks to you with folded hands, Padma Shri Dr. Mohsin Wali, sir. It's absolutely your blessings, your wishes, and irrespective of your busy schedule, you've given us your time. We're truly indebted and humbled. Thank you. Ladies and gentlemen, friends, it's time for us to welcome Padma Shri radiologist and healthcare pioneer, Dr. Harsh Mahajan, who's the founder and managing director of Mahajan Imaging, which is the leading chain of diagnostic centers at Delhi, the healers all across the world. May we please welcome Padma Shri, Dr. Harsh Mahajan, and request you for your.
Thank you very much, Simran, and happy Doctors' Day to everyone. At the outset, I would like to congratulate Dr. Sunita DUBE, a fellow radiologist, and Medscape India, an organization, an NGO that she created and that she breathes and lives on a minute to minute basis with passion, with care, uh, trying to heal India, trying to keep India fit. And this is a mission that she has undertaken. And really, right from preventive strategies to education of the masses, creating awareness both in the medical fraternity and in society at large, looking at changing policies for the better, for which she is willing to tap any and every door, leaving her own work and working for health of India. I think she deserves applause. She really deserves thanks for all the effort that she's put in over the years. There are many themes which are very close to her heart. We've already seen in the video the resuscitation measures, lacks of students, lacks of general population having been taught how to actually provide resuscitation, which, that 1 minute, 2 minutes are the difference between life and death. And at times, even in those who survive, if they do not get treatment on time, they may be left incapacitated and in a vegetative condition for life. So, this is yeoman service that Medscape India, its associates, the organizations, 8,000, service provider organizations, so many other organizations of healthcare, individuals who are associated with Medscape, I think provide a lot more energy to Dr. Sunita and her team to take this task forward. And one thing which has been very close to her heart, it is something she has been fighting for along with many of us, is protection of doctors. And towards that end, I think the doctors of this country do deserve a separate bill, a separate law, legal framework which is able to protect them while they are on duty and outside. Because we face patients who are in a very trying circumstances. There is panic, there is fear, there is depression. So many emotions are there amongst the patients, and equally importantly, amongst the attendants and the relatives who accompany them. And doctors trying to do their work within the constraints of their hospital, of their clinics, and then being attacked is something which is just unpardonable. And I think all power to Medscape India, to Dr. Sunita Dubey, and all other similar organizations which are working towards this end. I think there are no doors that Sunita hasn't tapped, and politicians, policy makers, other people who can actually bring about this law and this change in law is something we all look forward to, so that doctors can do fearlessly what they do best, which is heal, and not have to look over their shoulder and be in a fearful mode while they are providing treatment. So, thank you very much, Medscape India, for giving me this opportunity. Dr. Gangadhar is here, Dr. Wali, my dear friend and senior, is here, and so many others who've joined. Thank you all very much, and may Medscape India and Dr. Sunita DUBE get more power and keep doing the work that they are doing for the betterment of society, for the health of society, and well-being of our country. Thank you very much.
Sir, our founder, Mahajan Imaging, thank you so much for your best wishes as well. And you've always been a part of our family of Medscape India. Thank you for all the support that you give us. Means the world to us. Thank you so much. Thank you. Ladies and gentlemen, may we now have the address by Dr. J.L. Meenaji, a member of Medical Assessment and Rating Board from the Ministry of Health and Family Welfare, Government of India. And this is what she believes in: quality as a right. Yes, Dr. Sunita ji. Yes, we're going to have the video by ma'am. Making patient-centered, safe healthcare accessible and affordable to all. Ladies and gentlemen, please may we have this address by Dr. J.L. Meenaji.
Good morning to everyone and happy Doctors Day to all. Today's my topics for the quality improvements for better healthcare services. Before I go in the details, we know the general definition of the quality. The general definition of the quality is very simple: right work at the right time for the right clients by the right providers at the right place with the affordable cost is known as the quality. But when we say especially for the healthcare sectors, then first is the standard environment. Standard environment include the infrastructures, include instrument equipment, include trainings, include behaviors, and standard treatment as per the standard protocol and guidelines. And finally, the satisfaction for both provider as well as client is known as the quality. But a very simple definition of the quality, जो आपको चाहिए वो दूसरों को दो, that means quality. If you are the patient, what is your expectations? If you thinking this type of quality, कि if I am the patient, what is my expectation? And same thing you provide to the others. It's a quality. That's why I say the quality is just a common sense. Especially because in the medical error, one error can cause morbidity and mortalities. And सबसे बड़ी जो दिक्कत है, अगर एक भी error की वजह से कोई मौत होगी तो हम उसे वापस नहीं बुला सकते. That is the biggest problem in the medical field. And that's why in the medical fields, we need 100% quality. And if we are focused on the quality, then the first is the important things is the self-assessment is the best assessment for the improvement. This is the human nature that we are blaming each others. This is very easy. अगर मैं आपसे एक क्वेश्चन पूछूं कि भाई आप में क्या कमियां हैं, तो लिस्ट बड़ी छोटी होगी. लेकिन अगर मैं यही क्वेश्चन पूछूं कि दूसरों में क्या कमियां हैं, तो लिस्ट बड़ी हो जाती है. अगर मैं ये बोलूं कि अगर हर इंसान के पास सिर्फ 24 आवर्स है, इन 24 आवर्स को आप दूसरों की कमी निकाल के उसे इंप्रूवमेंट करने में दो, या अपना सेल्फ असेसमेंट करके अपने आप को इंप्रूवमेंट करने में दो, तो बेटर तरीके से हम क्वालिटी ला सकते हैं. सेकेंड इंपॉर्टेंट थिंग्स, अगर कुछ भी गलतियां होती हैं तो हम ब्लेमिंग गेम ह्यूमन नेचर्स में बढ़ा है कि ये ऊपर वाला नहीं करता, नीचे वाला नहीं करता, या बाजू वाला नहीं करता. बट कैन यू थिंकिंग व्हाट इज योर रोल फॉर द इंप्रूवमेंट? That is more important. If every person is thinking that what is my role for the improvement, then they give the better quality healthcare services rather than the blaming each others. Again, my questions is that when we say for the quality is never coming through the orders and other force. It is coming only from your heart. Because when you realize that in the medical field, one error can cause morbidity and mortality, then you realize the fact, reality, and then you come from your heart. And that's why I always say the quality is coming from your heart. And I again say the quality is the teamwork. It's never achieved by a single person. You know, if surgeon do the best surgery, but housekeeping is not proper, you can't prevent the infections. If nursing is not proper, you can't cure. If pharmacist is not proper, you can't cure. And that's why it's always a teamwork. If you give better healthcare services to the people of India, you first focus on the teamwork. And the biggest enemy of the quality is the चलता आया है, चलता है and चलता रहेगा. जो ये एटीट्यूड है, तो आप क्वालिटी कभी भी नहीं ला सकते. So go beyond the चलता आया है, चलता है and चलता रहेगा. The quality is very sweet for speak, but it's very difficult to implement. Why it's difficult? Because quality is never improved without truth. First you realize the truth. What is your weakness? What is the strength? What is the opportunity? What is the threat? Then you realize and improve the quality healthcare services. And the important thing is when you improve the quality improve only on the basis of the evidence-based fact and only the basis of the motivation rather than the fact findings, rather than the punishment. You focus on the motivations also. So the clear-cut message for the quality healthcare services on the day of the doctors day, my especially message that if you really improve the quality, the most important things, you do your self-assessment, you do quality healthcare services from your heart, you work as a team, and the important things, the quality is never improved without the truth. This is the clear-cut message for all our communities as well as the publics. Last, I really condemnations to all my doctors and pupils which recently lost life during the Ahmedabad plane crash, and also I especially condemnations to all the doctors which lost their life during the duty hours.